Hi, I'm Dr. Nick Circolone. Do you suffer from chronic pain? You're not alone. Over 100 million Americans suffer with chronic pain, and the number is growing daily. Let's face it, you've tried everything to get relief, from over-the-counter medication to hazardous prescription drugs, and in some cases, even surgery. Now there is hope. Stevax, an FDA-approved, non-surgical, non-medication device. Stop the search. Call today, 423-855-7376, and see if Stevax is right for you.
Everybody, don't move away from that radio dial just yet. I hope that you won't. This is Julie Edwards. So glad that you're tuned in to Chew in the Chat tonight. Health Chat, we call it. Dr. Nick Circolone is here from Apple Physical Medicine and Rehabilitation. I think you would agree with that song, wouldn't you? You got to move.
Always.
To stay healthy.
You know, it's one of the things. I was listening to that. It's been one of those days, I have to say. I got some news about my brother. We just talked about that. And, you got to move. The Lord's got you doing something. You better just be moving and going where you need to be going. It's just one of those things. I was listening to that on the way down here, just kind of jamming in my car, and I thought, I'm going to play that on the radio today.
Because you're in a place that a lot of people listening tonight maybe have found themselves before, and we're not going to get too personal with it, but I think people, when they hear your name around town, Nick, and when they hear you on the radio for sure, the image that they get in their head is, oh, he's that happy guy. He's always smiling. He's always optimistic. And I think that's your nature.
It is. And I'm optimistic about this, too.
But you're having a period of time. Your brother's been sick before. Beat it. There are some concerning things facing him now. And wouldn't you say that the best way to approach it is to be honest with yourself? Be optimistic. But when you're worried and scared, you got to let yourself be?
Either way, whatever happens, my brother's going to be all right. Either way it goes. My brother's dealing with a terminal illness, just the way it is. He was healed before of something. He can be healed again. He's a fighter. I mean, he's a comeback kid. My brother's 54 years old. Has been battling cancer. And, whatever happens, I think he's going to beat it. He's got a wife that is, determined that you're not going anywhere. So that's a good thing. And we have to be positive. Like, I'll get texts and we'll laugh about some silly things. Even in the midst of this turmoil, in the midst of this drama and basically horror, we're able to laugh about it because there was funny things that we can talk about.
Okay, but I'm gonna pause for a second because I think I've known you long enough to know that you would be quick to say that what you're dealing with in your family is difficult right now, but you would never want to try to compare it to what somebody else is dealing with and try to say, oh, well, my grief or my worry is worse than yours. Pain and turmoil, as you say, is relative, right? Each of us deals with it.
Everybody, it depends on what it is. Everybody deals with something in their life, whether it be joy or whether it be tragedy. But you know what? If you look at it the same way, it makes life a little easier. I never want to go through life hating people. I never want to go through life dealing with drama. I don't deal well with it. I don't deal well with conflict. If you want to have conflict, I'm just going to move away and, let you have your own conflict. You got that personality, you deal with that. And it's so funny because most of my patients that come into my office kind of gravitate to the stuff that we do. They may be unhappy, but they get excited when we get excited.
Okay, but a lot of the reason that they might be unhappy is because they hurt.
Oh, yeah. I mean, I deal with that every day. And not necessarily hurting physically, but they may be hurting emotionally. They may be hurting spiritually. They may be hurting in a different way. And sometimes you have to sit back and you go, wow, how can I deal and help these people? And we were talking earlier, things have gone 4.5 years. We talked about this. My practice has taken a really big change. And I'm like, okay, God, where are you in all of this? Where are we going to be? How are we going to get out of this? And I'm seeing this light at the end of the tunnel that is not only going to benefit the practice, but it's going to benefit other people. And I get charged up about that, Julie.
Well, I think it's relevant to bring up. If you're just tuning in and hearing Nick for the first time on the air, you might think, well, why is this guy getting so personal? You take everything personally. I don't mean that you come in and just take over a conversation telling your patients about what you're going through. You're first interested in what they're going through.
Oh, absolutely.
But you're a person who's very quick to share. And so I would think that makes your patients feel a lot more comfortable in your care because they know that you've overcome difficulties and look for ways to still make things work.
You know, a lot of people, if you've listened to it long enough and heard me and talked about and even met me, you'll realize that I was a plumber and pipe fitter before I became a doctor.
Wait, I can go back before that. I didn't know you then, but before you were the plumber and pipe fitter, you were a kid who had a terrible accident.
Yeah, I did.
And you shouldn't have lived.
No,
right?
it was amazing. I mean, yeah, you know, I've been saved. The Lord saved me for a reason, and I really have to think about that and go, what is it for? Is it I'm to help other people? I've taken this new mantra in my life, and it's like I go to work, I do what I do to help other people. Like, yes, I enjoy what I do, I love what I do, but I'm there to help other people. When I leave my office, I'm there to help other people. I want to be a servant to people. I don't want people, I don't like people serving me. It kind of bothers me.
Yeah.
You know, it's like I would rather serve you and do for you than you do for me.
But when you were the kid with that accident and you weren't supposed to get over it and live through it, it was a terrible orthopedic injury to you, right?
That was a neurological injury. I crushed my skull.
That's what it was.
Yeah. Yeah, and I broke my leg. I mean, there was definitely some orthopedic stuff that was involved. If you would have told me when I was 15 years old, sitting in class and going, this stinks. We were talking about Meg earlier. It's like, this is terrible. I don't want to be here. I was one of those kids that would sit in the back of the classroom, feet up on the desk. I would wear my green army jacket. Tell you how old I was. My green army jacket, had my cigarettes in my pocket. And I was like, man, I need a smoke break right now. And
when you were in high school?
Yes.
You rebel.
Yes, I was. And I was one of those guys that would just take the test and go and pass it. I tell you a funny story. The National Honor Society came up to me and goes, hey, you want to join the National Honor Society? And I went, no.
Wait a minute. If you weren't doing so great in school,
I didn't say I wasn't doing great. I just had a bad attitude. Okay. I had a bad attitude. And they said, you want to join the National Honor Society? I said, no. They go, why? You got the grades. I said, you're a bunch of geeks and you girls are ugly. I'm not joining.
Nick, you said that?
Yes, I was stupid.
You were stupid.
I was really stupid.
I was in the National Honor Society.
Yeah.
I joined.
You know, and I said, and I was like, really? I was too cool to be with them. It was just stupid. I was stupid.
So what changed it for you? You're not stupid anymore.
Well, no. It was one of those things where my life, and we're talking about something totally different than we were going to talk about anyway.
We always do. We'll get on topic in a minute.
But my life really changed when I was probably a teenager. I was a rebel. I did things I shouldn't have done. I'm so glad I'm not in jail or was in jail. You know, I was saved for a purpose, to do something different. And I didn't know that at the time. But then when I became older, I was like, you know, I don't want to go to college. I just want to do work. And I made a good living at doing plumbing. And then one day I just said, I got to do this. I got to change my life. And we can do a whole show on that. But I changed my life and I said, you know what? I'm going back to school. I quit my job, went back to school. I first went for teaching, and then that didn't pan out for me. I didn't like it.
Because you didn't want to be the teacher with the kids with their feet propped up on the desk in the back of the classroom with cigarettes in their pocket.
I would have been the one teacher that flung erasers. Seriously. Smack him in the back of the head. Yeah, I would have done that. But anyway, so I actually made a huge change, and I said, you know, I went to become a doctor, and everybody was like, are you nuts? Like, how are you going to go to school to become a doctor? I was like, I'm going to do it. And I did. And I remember my family was like, yeah, okay, he's not going to follow through with this one. And
you did.
Yeah, I did. I remember walking across the aisle and looking at my mom and my dad, and I could just see my mother's face going, he did it.
So he talks about how he wants to help other people. He's really excited. He has been for the past, month? month or two?
I've been so excited since we've started trying to change things.
So we got to go to a commercial.
No, we can't.
We have to. But if you have any kind of issue with the following: migraines, if you have knee issues and knee pain, what else?
Joint pain.
Joint pain.
If you want to know about PRP,
okay,
plasma-rich protein, stem cells, we'll talk about it all.
We're going to talk about it and what they're doing that is making people feel so good so quickly. 267-1023 if you want to call in and talk to Nick. We're back talking more in just a second.
Too blessed to be stressed. Too blessed to be stressed.
I think I don't want to do the show anymore. I want to just listen to your musical choices. Is that okay?
Why not?
Was that your idea or Gene's?
Mine.
That was Nick's idea. Gene Levin's loving your musical choices tonight. Okay, we're back on the show. We'll talk about music in a minute. Let's talk about knee pain for a minute. We went to break with that. Okay.
I don't want to do. I want to be.
I know. You're too blessed to be stressed. But I got to stress you out for just a minute because we got to talk turkey. Because there are a lot of people. Look, that's a huge complaint among people. It's a runner's town. Chattanooga is. You're going up and down stairs all the time. Your knees take their toll as you age. People are facing knee replacement surgery, and you're seeing some changes in your office happen pretty rapidly.
It's really cool. What we're doing, again, we're not inventing the wheel. We're like BSAF. We're making it better. You remember those commercials?
Yeah. That's crazy.
So
that was very good, Nick.
Yeah, that dates us out, doesn't it? So what we're doing is a lot of times patients have knee pain. First thing they do, let's get cortisone. They get cortisone. Hey, I feel better. A couple months down the road, they're still feeling better. A couple years down the road, oh man, my knees are killing me. They're still doing the same thing. Let's get another cortisone shot. The cortisone's not working really well. Doctor turns around and says, hey, let's put some hyaluronic acid in there. Don't worry about what that is. It's just, let's put that in there. And maybe we'll do a little bit of PT. Oh, it failed. Well, now we got to do a knee replacement. Really? There's other things that are coming. Science is catching up to us. It's
what is it what is happening though that causes a person to need or to have that degeneration happen? Is it just
osteoarthritis, wear and tear arthritis?
Is it just age and natural aging?
No,
or
not necessarily. I've seen osteoarthritis in young people. People that played sports and things like that abuse their bodies, and now we're getting this osteoarthritis, and they're getting knee replacements. Here's the thing. Not only are they getting knee replacements, before they get the knee replacements, they're taking a ton of medication to kill the pain. And so we've designed this program, yay, I'm so excited, where we're dealing with the pain without medication. No more of this hydrocodone and this opioids. We're trying to pull away from that. Some people can't, but we're going to try not to do that. Then what we're doing is we're taking a damaged area, such as the knee. We'll use the knee. We're doing other joints. And we're injecting that hyaluronic acid to help rebuild the cartilage. Well, we're also bracing them. So what we're doing is we're taking that tension off by these proprietary braces that we use that takes the pressure off the knee so that way this hyaluronic acid can work. Well, it might not work. So then what we do is we'll do what's known as PRP, plasma-rich protein injections. We'll turn around, draw your blood, spin it down, pull out this plasma that's in there, inject it into those areas.
Same day.
Yeah, yeah. We draw not with the hyaluronic. We're doing this first. Then, as that's working, we'll see how that's working. Now we're putting new or stem-like cells of your own into this joint.
So essentially, your body is healing itself.
We're trying to make it heal itself. Yes. If you're a sports guy or sportswoman, you know what PRP is because that's what the sports guys are getting right now. They have a damaged elbow, they have a damaged knee, they have a damaged shoulder. PRP, plasma-rich protein injections. Let's do it. It's kind of the wave and the new thing. They're also using plasma-rich protein for hair restoration. That's another story. And for facials, there's great stuff with the plasma. But let's say the plasma doesn't work, the plasma-rich protein doesn't work. Then we go with stem cells. Now we start a regenerative process by using these stem cells.
Okay, now wait a minute. There are a lot of people listening saying, I don't want to use stem cells because they're thinking of them as being fetal.
No,
That's
and
not
it's
what
not. These are not. They're coming from the cord or the placenta. These are not coming from fetuses. I wouldn't do that.
Okay.
So there's a special bank that we use, And they're the ones that are coming out now. And the stem cells that we use to regenerate areas is called mesenchymal stem cells. Well, when you get stem cells before, this is not now, but before, you would get a series of stem cells. We don't know how many mesenchymal stem cells were in there. There's a bunch of other stem cells, but now we have the mesenchymal. Expensive process. Well, now the company that we're dealing with came out with a product called Wharton's Jelly. This has pure mesenchymal stem cells.
So it's 100% the good stuff.
Exactly. 100% expensive, too. So what we're doing is we take that and we inject it into the knee, and then we've already tried, we've bracing it, we've done the hyaluronic, we've done the PRP, now we're doing the stem cell. Instead of just going right to the stem cell, some people will benefit with this other stuff first. Now, the bracing, the stem cell, the bracing, the hyaluronic acid, the way we do it, the process that we do it is paid by insurance. PRP is not. Stem cells aren't. But we're using bracing, and we already have the brace. So the cost of this, we're trying to bring the cost down so it's a little more cost effective.
Okay, so somebody comes in, their knee's been giving them fits, they've tried various things, you get a general clinical study on them, what their history is. The first thing you do probably is try the brace, or is it always case dependent?
No, I got to see what your knee looks like. We're going to do an X-ray. Sometimes we'll do an MRI. We'll go the next step because a knee may be beautiful. There's they're using the Kelligren scale to grade it 1 through 4, 4 being the worst. And what we're looking at is I've seen a beautiful knee, grade 1, no, not too much degeneration. Took an MRI of this. It looked like somebody threw everything in there but the kitchen sink.
Was it not bothering the person
Oh,
terribly?
it was killing them.
Okay.
But the MRI is the only thing that we found that was in there, and that's when we want to do some different things to it. Great example of that. Gentleman came in, was going to get surgery next week. Going to get surgery. I'm telling you, I'm sitting in, and I know this person, and I've known them for years, and I'm letting them go get surgery.
Why did he come in if he had the surgery scheduled?
He came in for other things.
Okay.
Low back,
Okay.
And he's, well, I'm going to get my knee replaced. And, I looked at it, and the MRI showed that it was just trashed. And I thought, oh, yeah, you need a knee replacement. I am not kidding. I felt this feeling come upon me and go, why aren't you telling him about what you're doing? I don't know. And I did. And I went back and I grabbed one of my braces. He works in construction, so he climbs ladders, up steps, everything else, because I wasn't able to do it. So go get the brace. So I go get the brace. I put the brace on him. 70% improvement following me putting the brace on. 70%. I literally had him stand on a stool and go up onto a table and back down, and he was better. 70% better.
So then what? So do you leave it at that?
No,
What do you do now?
Now what we're going to do is we're going to do an arthrogram of the knee. What instead of just injecting these areas, we're looking to see what it looks like inside.
Okay.
We want to see what this is looking like. We want to make sure our needle placement is in the right place. We want to make sure the medication is going in the right place. That's the difference. We're not just blindly giving. If you've had knee injections before, you know that they're done blindly. They're just stick the needle in, stick it in, and go, and you're done.
But you're figuring out where to put it first?
We're actually visualizing this knee. This is how we're doing things.
And you're doing that through that
It's called an arthrogram.
Arthrogram.
But what we're doing is we're using fluoroscopy unit. It's a high speed. It's an X-ray basically that we just take a picture of it and we can see the fluid flowing through the knee and making sure that we're putting it in the right place so we get the best benefit.
Okay, so you said something earlier about how this construction worker who has the brace now is somebody you've known for a while and you knew he was doing the surgery. I'm going to play devil's advocate with you for a minute because I think that you are not always going to be a person who says no to surgery.
No, and I'm not. But here's the thing. What if this doesn't work that we're doing? What if it doesn't work?
Well, so you're out some time.
And he can get a knee replacement if he has to. But at least we're making the shot. And this is the best part about this. He had reservations about the surgery. If you're going into an elective surgery and you have reservations about it, 9 times out of 10, there's a bad outcome. Because in your head, you're not ready for it.
Right.
But if you're ready for it, I've seen patients do so much better after surgery because they were ready for it. If he has to get surgery, and we're hoping not, but if he has to get surgery, he'll have a better outcome because his mind's in it.
So with this PRP and what's the
hyaluronic acid.
What is that? What is hyaluronic acid?
It's basically it comes from the coxcomb of the rooster. Somebody found it, and it helps.
Who would ever think you could get medicine out of the coxcomb of a rooster?
Researchers do crazy things. But what happens is this was known to regenerate cartilage. So that's what it's been used for. And now it's the only thing, not the only thing, but when you go, you have to show that you've gotten these injections and done some other form of treatment before you can get a knee replacement. The insurance companies won't pay for it. They're requiring you to get this.
Which means that they're validating how beneficial these treatments can be.
Right. But if you just do an injection and do a little bit of PT and nothing else and maybe a brace, nothing's in there. So we're not only bracing them, we're not only doing the injections, we're doing PT with them. We're doing the whole ball of wax in the office. Now, here's the other part.
What?
The Stevax unit that we talked about before, the vagal stimulator, is part of our process right now.
Okay, what? I'm going to put you on hold. We got to catch a commercial because the Stevax unit is so cool. We want to give plenty of time to talk about that. So for those migraine sufferers out there, this is your part of the conversation coming up when we come back.
Pain sufferers, period.
Anybody. We're back in a minute. Welcome back to the show, everybody. I want to talk a little bit more with Dr. Nick Circolone from Apple Physical Medicine and Rehabilitation about migraine sufferers. Going into the commercial break, he mentioned anybody who's dealing with pain can benefit from this revolutionary, I think, new product that they have now at Apple Physical Medicine. It's called a Stevax unit. Nick, whenever you want to jump in, jump in. But what's so cool about this, 267-1023, by the way, is the phone number for you to call in and ask a question, because chances are a lot of you will. This thing is approved by insurance. Medicare pays for it as well. It will possibly not cost the customer anything, if totally not cost the patient anything. Is that correct?
Well, it depends. If you have a secondary insurance, I mean, there is a cost. I mean, you have to still pay for the office visits, things like that, but it's nominal. It's nominal. What's really cool about this, it's a neurostimulator that is implanted, and I say that loosely, I say that all the time. If you listen to our other shows, it's got this two little needles that go in the auricular of the ear.
It's the size of a quarter, not even.
The unit is.
Right.
But the little pad is tiny, 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 tiny. So it goes in, electrical impulses are generated through the generator, and the generator is about the size of a quarter. And you wear it for 2 weeks. And what it does, it helps maintain or increase your endorphin levels to decrease your pain. And we can control this. Unlike other units that may be out there, we have to change it. We have to adjust it. You can't do that personally. You have to come to my office and have it changed. There's a special way to do that and a special tool to do that. But what happens is we increase the stimulation to increase the endorphins. It's on for 2 weeks. It's off for a week. Then we put another unit on you for 2 weeks. It's off for a week. Then we put another unit on. It's on for 2 weeks, off for a week, and then we don't do it anymore. And what we're doing is we're finding to increase the endorphin levels to decrease your pain. So what we're doing is we're decreasing your pain without the use of opioids.
Okay, so what it's doing, like in those first 2 weeks, and you set the levels, do the levels ever change within that 2 week period? Or once they're set for those 2 weeks, they're set for those 2 weeks?
No. The first week we put it on, and we find a level that you're comfortable at. The unit goes from 0 to 16.
And how do you determine that? Like, what is the patient experiencing to determine comfort level?
You'll get them to almost feel, I feel pretty good right there. It's not annoying me. It's comfortable. And then as time goes on, then in the following week, you go, how are you feeling? Well, I'm feeling a little bit more pain, or I'm feeling less pain. And you bring it up a little bit more. So now what you've done is you've increased the intensity of it to decrease their pain level. So what we're doing is we're trying to find and titrate this level of where we can get the maximum. So it's FDA approved, and 3 units are the approval of it.
Right. Okay, so I'm sorry that I'm thick-headed, but I don't think I'm the only one who might struggle to get this a little bit. So back to the migraine sufferer. Let's talk about that person for a minute. Or no, let's not
Pain in general. Just pain in general.
Let's do something that's more constant because migraine can come and go. So you come in, you've got just joint pain somewhere in your body. That's just really an inconvenience. So you put this Stevax unit in behind their ear. Right?
No, it goes in. There's a little. It's two little, like acupuncture needles. Their gauge is about a 32, which is really tiny. If you think about your earring's about a 20.
Okay.
So the higher the number, the smaller the needle, and it literally like a little thumbtack goes in there, and that just stimulates that area.
Okay, so then you in your office are kind of setting it. It goes in the ear, and now you're setting it to see.
You only set the little instrument. You only set the little unit itself. It's called a pain generator,
Okay.
or a neurogenerator, a neurostimulator. Excuse me, and it's really tiny, and you have to use a special tool to adjust it. You cannot adjust this yourself.
So when someone's in your office and they're having one put in, and they say my shoulder really hurts me horribly, then once it goes in and you adjust it, some of that pain should begin to go away right away.
It'll start to go right away.
Okay, so then they live with minimized pain, not totally free of it, but minimized for those first 2 weeks.
Well, it might go away totally. I mean, everybody's different.
Okay.
Everybody's different. Now, the thing that happens is, there's a group that does this. I'm going to be the one in Chattanooga doing this. And what happens is we all talk. So all of the units that have been implanted, people are walking out. One woman, she couldn't sit down. She left the office and she's like, I could sit now without pain.
That's just so crazy to me. So you're just like with the PRP, your body's healing itself.
Well,
with
you're increasing the endorphins. So think about this. If you have pain and you get breakthrough pain, you're taking hydrocodones, you're taking opioids.
You're masking it.
You're masking that pain. Whereas with this, you're still masking pain, but you're masking it naturally. So if it's just pain, see, sometimes we have pain, we have more pain than we do a problem. So if we can decrease the pain, your function's improved. So now we can do better things. Great example. Let's just say you come in with knee pain. It's going to be, people come in with chronic pain. I said to somebody, do you have pain every day? Well, yeah, I think maybe a little bit, but it's not bad. It's like a 3. A 3? If you live with pain, a 3 every day, that's like, say, somebody tapping you on the head.
Chinese water torture.
Exactly.
Every day. Right.
So with this, we're going to try to decrease that. Try to decrease your medication. Let your body start healing itself because you're not taking all this garbage. Think about this. Hydrocodone and some of the other opioids have acetaminophen in them. It's bad for your liver. You're toxifying the livers. So if we can get you off of them or decrease them considerably, what's your health going to be like?
So how do you determine who's a good candidate for this Stevax unit? Because nobody wants to hurt. So if you hurt for a week straight, does that make you a candidate, or only if you've been dealing with it for a number of years?
No. The two key words are chronic pain. After 16 weeks, it's chronic. It just is. Now, are you going to come in the office and you have this giant, we'll use a disc, giant bulging disc, pushing on a nerve, squeezing it out? Let's do a Stevax unit. No, let's get the pressure off the nerve. Once we get the pressure off the nerve, instead of maybe taking opioids following the surgery, we could use the Stevax unit. These are things that we're working on, and we'll be working with other doctors to be able to do.
Okay, what if you're somebody who doesn't have a bulging disc and you don't seem to have any real health problem that you can quite diagnose or see in your office, but maybe you've got a weight issue, and so you can't get up and exercise because you hurt all the time, and then you can't get better? Would that be something that...
Usually there's something behind all of that. So here's one of the things that we do is we call and you come in for a consultation, look at it, make sure everything's all right. We get information from you about where you've been. Who's your doctor? What have you had done? What therapies have you done? What injections have you done? What medications have you taken? We ask all of these questions. And then we contact your family. Let's say we think, you know what? I think you're a candidate for this. Let me make the next step and call your family doctor or your orthopedist or your rheumatologist and find out what's going on. Then we say, okay, you have a list of chronic pain that we can see if we can help. Then we start and we say, okay, you're a good candidate for this. Let's go for it. Chronic pain is the key. What the chronic pain is caused from is totally different. Whether it be fibromyalgia, whether it be headaches, whether it be osteoarthritis, whether it be degenerative joint disease, whether it be spinal stenosis. Could be a lot of things that maybe you're not a surgical candidate for. Good example, you're an 85-year-old man with spinal stenosis or foraminal stenosis. You have a lot of pain associated with this, but you don't have anything but pain. Remember what I said? We don't have any neurological deficits. We don't have any motor deficits. We just have pain. They would be a perfect, and the doctor says, you know what? You're not really a good candidate for surgery. I don't want to do surgery on you.
Right.
Here, start taking all these medicines. Really? Let's try this too to get you off of that medicine.
So when patients come in to you, and then we'll go to commercial, but when they come in to you, if they are taking medications to mask the pain, do you want them to use the DVAX unit, if that's what they're approved for, and then stop taking the medicines?
Oh, we don't stop anybody from taking anything. We work with their doctors. Hey, Dr. Smith, we got Miss Jones in here. We're doing this unit. Here's the information on it. Let's see if we can get her off of some of this pain medicine. What is he going to say? Yeah, let's do it.
Okay. We got callers calling in. Hang tight. You can keep calling in as well. Going to catch a quick commercial. Nick and I are back to answer your calls in just a minute.
You gotta move. You got to move. You got to move. You got to move.
Welcome back, everybody. 267-1023, the phone number for you to call in if you have a question with our remaining moments. For Dr. Nick Circolone. We had a caller call in. She had to go, but her question was she wanted to know your address and phone number because she's interested in bringing her mom in to see you. Needs to know where to find you.
Easiest way to do it, call the office. It's 423-855-7376. Talk to one of my lovely ladies that works for me, and they'll take care of you, give you addresses and everything else, tell you what you need to do. Again, it's 423-855-7376.
If you're familiar, though, with Chattanooga at all, and the caller is still listening, just take I-75 up to, Shallowford Road?
Yeah, we're off of Shallowford Road there by the YMCA. So it's really easy to find me.
Yeah.
It's 7446 Shallowford Road, Suite 108.
So you were saying when we got the call, this is the reason that you enjoy doing these radio shows because people are listening. And the truth is, a lot of people listening might not need it right now, but a month from now, they may have a conversation with somebody and they can go, oh, I heard that guy on the radio talking about this really cool procedure that could help. You just want to get the word out to people.
And I'm telling you, it's fallen so close into my wheelhouse. I've been a doctor 25 years. It feels like I've been doing it for, I don't know, a week. Sometimes it's just amazing. I walk into my office and I get there really early in the morning and I look around and I go, wow, I can't believe I'm here. I have this huge office. And at one point I thought, I got too much room. Now I don't know if I have enough room.
Okay, so since you've been in practice for 25 years and you look at really, I think this is all revolutionary.
Did you just say I look it? Did you just say I look it?
No, you don't look it. Don't put words in my mouth, Nick Circolone. But do you look around, do you look around at the way things have changed and you wonder what's going to come next? Who would have ever thought that you would be talking about the procedures you're going to use and are using now? What comes next?
Well, I don't know. But here's what's cool about this. I went to school and I became a chiropractor. Chiropractic is one of the most awesome professions you can do. I help people get out of musculoskeletal and neuromusculoskeletal pain. It's amazing. The education that I've had, my fellowship in orthopedics. But, for some reason, we're still a redheaded stepchild of the medical profession. We're accepted. It's acceptable treatment. We do a great job at what we do. But I thought, in order for me to do a better job at what I do and enjoy doing, I'm going to have to add something else to offset some of the things that were going on. So I added medical. Falls right in my wheelhouse. We do neuromusculoskeletal stuff. That's what we do.
Right.
And doing the injections, doing the stem cells, doing the PRP, doing the pain control. This is right where I need to be. And I think this is where the future of medicine's going, is multidisciplinary practices. We have to work together as a team to help the patients. That's just it.
Okay, I told you I played devil's advocate. So since the caller was calling for her mother, I would imagine a lot of patients who you might see coming in, well, they'll be of all ages. But just to talk the money side of it again, I think people get a little bit fearful sometimes when something is brand new and they think, oh, well, what if it's going to cost me an arm and a leg? Remind people that this is not that.
It's not brand new. And you know, this is the beauty part about this. When I was the first chiropractor in Chattanooga to do decompression therapy, I don't know if they're the first doctor, and I tell Bill Moore Smith and I are kind of right there together at the same time. We were advertising on talk radio at the same time, but we were the first to do decompression therapy. So everybody that comes in, oh, I'm the first to do no, you're not. No, you're not. So I've been doing decompression therapy forever. It's an FDA-approved procedure that insurance doesn't pay for. So people got to pay out of pocket to get decompression therapy. If you've ever had decompression therapy, if you've ever had to pay out of pocket, it's very expensive. You have to sell that. It's hard. You know, I believe it works because I've been doing it for so long. I still do it. But here's the thing. Steve Axe and some of the stuff that we're doing, except for the PRP and the stem cell. Let's get that out.
Yeah, right.
This is covered by insurance. This is not like, oh, how much am I going to have to pay? Medicare, let's use them as an example. If you have a secondary Medicare insurance, there's a nominal fee, if any, with Medicare. If you have Blue Cross Blue
But
Shield,
you do that for an antibiotic.
yeah.
Right.
If you have Cigna, if you have Blue Cross and Blue Shield, if you have TRICARE, we're working on getting all of that in right now. We're still in the process of going through that, but we're in pretty much every single insurance company. So there may be copays involved, there may be deductibles involved. All of that stuff is in there, but it's covered by your insurance. When you look at the fees, I can't tell you exactly because I'm not sure, but the fees are nominal compared to what other things are out there.
Well, I just thought it was relevant to bring it up again because you are very excited as you talk about it. But when people hurt, they hurt. And they want something to help them quickly. And I think skepticism is just something we all carry with us a little bit. And for me to be able to ask you the cynical questions, I think is a good thing.
Well, I'll be perfectly honest with you. There is an ulterior motive why I do what I do.
I think I know what you're going to say.
What am I going to say?
Because you like to help people.
I do, but you know the other thing is that when I get my hugs, after people feel better from what I do, that's the best part. And somebody says, "Oh, you're going to get in trouble for hugging." I'm going to get in trouble for hugging everybody because I hug everybody.
Yeah, he does. That is a true
I don't
statement.
care if it's a man. I don't care if it's a woman. I hug everybody. And it's not like, and if it was ever creepy, I don't hug. I'm not a creepy hugger. I hope not. But I want to love on people. And it's important that when you're hurting, when you're dealing with something, that somebody really cares and listens to you and says, hey, we're going to try our best to fix this. I may not be the doctor for them, but I'm going to make sure I find the doctor for you.
And you listen.
I try to. You know, I have, real quick, I had a patient come in, young guy, dealing with all kinds of garbage, thought it was a musculoskeletal problem. I don't think it's a musculoskeletal problem. I sent him to a doctor that's going to look at it, and I think he's going to be better. I still can work on his spine and other joints, but what he had was, and he was being pushed around. And he said, you know, Doc, you're the only one that really listens to me.
Okay, so let people have your phone number again. They can call and be heard.
It's area code 423-855-7376. It's Apple Physical Medicine and Rehabilitation. You can look at our website. It's applerehabgroup.com. You could talk to Shay, Becca, or Alyssa at my office. Again, the number is 423-855-7376.
But when you come in, he's going to hug you. I hope your brother gets better.
I do, too. We're going to find out more later on.
Have a good night, everybody.
God bless.
Too blessed to be stressed. Alright, too blessed to be stressed.
Hi, I'm Dr. Nick Circolone. Do you suffer from chronic pain? You're not alone. Over 100 million Americans suffer with chronic pain, and the number is growing daily. Let's face it, you've tried everything to get relief, from over-the-counter medication to hazardous prescription drugs, and in some cases, even surgery. Now there is hope. Stevax, an FDA-approved, non-surgical, non-medication device. Stop the search. Call today, 423-855-7376, and see if Stevax is right for you.